Oh, how much fun it is to be in this Washington. Thank you for having me. My name is Lawson. I'm the Executive Director of Social Security Works. Let's start with just recognizing how amazing Pramila Jayapal is. You all have a fighter fighting for you and all of us every day in her. And you know what she gets for that? The absolute hatred of the billionaires, those venture capitalists, the corporate insurers, and all of them spend as much time as they can trying to defeat her. But you know what she's got? Us. She's got the people. They might have money, but we've got people. So I want you all, again, to recognize that none of this happens without you, that everything that we have accomplished is because of you, and I want you all to give yourselves a round of applause for getting us where we are today. And I will do my where are we today, but first I want to just do a little deviation from what I usually talk about to one of my favorite genres of political articles that you see. And I'm sure you've all seen them. If you haven't, just Google it. But have you ever seen those articles where they're like, why do the French live longer than Americans? And then they're like, the French smoke more cigarettes and they drink more wine. How are they living so much longer than Americans? And then they go through a bunch of things and they're like, it's probably the long walks that they take, right? Or they're like, why do Canadians live longer than Americans? Is it the poutine that they're eating? We just can't figure it out. Why does America, the richest country in the history of the world, have the lowest life expectancy of all of our peer countries? You all tell me, what is it? No health care! Do you think it's possibly the fact that only in our dumb system do people not go to the doctor until they cannot not go to the doctor? When they initially get sick or they feel something, their first thought is not, I need to do what I have to get well. Their first thought is, I hope I don't bankrupt my family. That is a shame on our country. And they're right. That's the thing. They're right. In this country, a person with a cancer diagnosis, 80% of people with cancer diagnosis have exhausted their life savings within 2 years. That is a shame on our country. And why? Why is our system set up this way? Is it broken? Do you all think that it's broken? It's not broken. It's not a healthcare system. It's a wealth extraction system. It's functioning exactly as it's supposed to. But what it does is not keep us healthy. It keeps us sick for profit. They delay and deny our care to kill us for profit. That's how they make money. Do you know who they delay and deny care to the most? Those who need it the most. Why? Because from their point of view, on their computer systems, those are the most expensive people. They want to provide health care to those who don't need it and deny people who do need it. Do you all remember, do you all know why Medicare was created? Do you remember or read the stories? Was it an act of benevolence? That's rhetorical. No! It was because the insurers wouldn't insure people over the age of 65 because their actuaries said you can't make money insuring people over the age of 65. So they just didn't have anything. And at that time, we still had almost 1 in 3 seniors living in poverty until Medicare was created. It was not because of anything other than the failure of the corporate insurers to provide health care that we created Medicare. But now, 58 years later, we're in a little bit of a different place. I hate disagreeing with, and it's not disagreeing, I hate being on a different place than Pramila Jayapal, but she was using one-year-old numbers. She said $41 billion ripoff, but the latest numbers, excuse me, the latest numbers, $75 billion in overpayments last year. Does anyone here know what the entire budget of the EPA is? It's $8 billion. Really get that into, I have it written down, it's right here. The federal prison system, $7.8 billion. Environmental Protection Agency, $8.7 billion. The Federal Bureau of Investigation, $9.8 billion. U.S. Customs and Border Protection, $16.7 billion. Medicare Advantage overbilling, $75 billion. That's a shame on this country. And yet in DC, I have to sit there and people are like, look, we'd love to add vision, hearing, and dental and long-term care, but how are we going to pay for it? How about we stop getting ripped off? We stopped getting ripped off 2 years and we got $150 billion. This isn't a choice. This isn't there's no like, oh, well, on the one hand, we should let people die, but on the other, these CEOs definitely need another golden yacht. These private equity guys need to be making billions of dollars a year. We are up against evil. There's no other way to describe people who will kill people for profit. And that's what we're talking about. So obviously, stop the overpayments. Let's stop getting ripped off. Let's take that money and put it back into traditional Medicare. Let's add vision, add hearing, add dental, add long-term care, and out-of-pocket cap. Why do people have to pay 20%? The only reason they did that there's that hole, that gap in Medicare, is because the billionaires drilled the hole in it. Let's fill that hole. Let's guarantee health care for every person in this country. If you get sick, you get the care that you need. That's not rocket science. Every other peer nation of ours can do it. We pay the most for the worst health care of any of our peer nations. And it's time to stop that. Now, right now, I do want to say, unfortunately, we are losing. We are losing on protecting Medicare. For over a decade, it's just been more and more and more people coming into the Medicare Disadvantage program, which are just corporate insurers. And the only reason that they do it is they know that they can get $75 billion in overpayments, and they're allowed to delay and deny care. They're allowed to kill people for profit. That's what Medicare Disadvantage is. That's why they're coming back in, because they're allowed to delay and deny care, and we have to stop that. We have to stop that. I want to talk about a little smaller things that we can do immediately, and Congresswoman Jayapal brought them up. We need the Biden White House to, they know the delay and denial rates of all of these plans. Do you know how many Medicare Disadvantage plans there are? Because there's 4,000 of them. So to pretend that there's one Medicare Disadvantage is part of their game. There's 4,000 different plans, and they have different rates of delays and denials. Some of them are as high as 33%. 1/3 of the claims are denied. But who had to go through the process when they chose between traditional Medicare, Medicare Advantage, and then all of the different plans? It's incredibly confusing, and nowhere along there do they say something like, if you choose this plan, 33% of your claims might be denied. Oh, and by the way, you might die because of that. If you have a chronic illness, you're almost certainly going to be hurt by the delays and denials, and you might be killed by them. We just had last week a day of action. We had 100 seniors come to DC to fan across the hill and talk to their lawmakers. And we had a woman join us whose father was killed by United Health by an algorithmic denial of care. So not only it's obscene that there's any delays and denials, but this was the robot. It was just an automatic delay and denial. They could not figure out what human to talk to. It's like if you get locked out of a social media account and there's no phone number to call. That's the even worse future, where they just automatically delay and deny, and you can't even figure out how to, who to call to challenge that. That's an obvious one that we need the Biden administration to stop. Absolutely, we're going to keep working until there's no more delays and denials, but no robots should ever be in charge of our healthcare. No algorithm in charge of anyone's healthcare. One single doctor for each medical intervention. Because before the algorithm, they just had doctors denying people 60,000 claims at a time. I'm not going to rest until the private insurers are gone, because they do not deserve to exist. They're parasites. All they do is take our money and deny our care. But there are things that we can accomplish right now, and we have to forcefully demand them. No more delays and denials by algorithm in Medicare Advantage. The Biden administration could do that with the stroke of a pen. Everybody should know every single delay and denial rate of every single Medicare Disadvantage plan. It should be printed on the website. CMS knows that, and they hide it from us. The Biden administration could change that with the stroke of a pen. These are things that are entirely doable today. And working together, I am positive that we can do it. So what do you all think? Can we get this done? Yeah! When we raise our voices together, they cannot ignore us. Thank you so much for letting me talk with you today.
Thank you so much.